Welcome to Blizzard Fire. We hope this video helps fire up your solution.
You start now. Remove tight clothing and anything touching the rash, because ongoing contact keeps irritation going. Once done, gently wash the area with lukewarm water and a fragrance-free mild soap for about 30 to 60 seconds to remove irritants and pollen. Pat dry. Next, apply a cool compress for 10 to 15 minutes to constrict blood vessels and reduce itch. Make sure to avoid scrubbing and do not apply ice directly. Instead, wrap it in cloth to protect skin. You now treat the rash with a simple, safe over-the-counter approach. Select a 1% hydrocortisone cream if inflammation and itching dominate, or a fragrance-free emollient when dry or irritated. Before full use, perform a 24-hour patch test on nearby skin to check for allergy. Once clear, apply a thin layer 1 to 2 times daily, and keep the area clean and uncovered if possible to breathe. Make sure to monitor for spread, foul odor, fever, or increasing pain. Those are warning signs. You finish by protecting the healed skin. Wear loose, breathable clothing and avoid sweating, hot baths, or harsh soaps that can reignite irritation. Once the rash improves in 48 to 72 hours, continue gentle care until fully resolved. If improvement stalls, stop current creams and consult a clinician for targeted therapy. Finally, be ready to act. If the rash rapidly spreads, produces pus, causes fever, or severe pain, seek urgent medical attention, because
Thanks for watching. If you found this helpful, don't forget to like and subscribe.